Hey guys, Jimmy Yen here, the neurology acupuncture specialist coming to you on Thursday. Thursday, we're going to continue. Ooh, I didn't change this. It's supposed to be Treatment Thursday. Still kept it as Why Wednesday. So, Treatment Thursday. So, we're going to continue to talk about pulse. Because my first talk, I think I did it on Tuesday, right? I did it on Tuesday or yesterday? No, yesterday. Why Wednesday? So I did yesterday. I started talking about pulse, and I only did the right side. And so some people wanted to know what's going on the left side. So on the left arm, what can we detect? So going just a refresher, remind us what is pulse diagnosis and what is functional pulse diagnosis. So pulse diagnosis is the gold standard that acupuncture clinics, Chinese medicine clinics, and Chinese medicine in general uses as the way to detect what's going on in the body, why isn't your body healing itself. And we do our version, our form of pulse diagnosis, and we call it functional pulse diagnosis. And functional pulse diagnosis is detecting organ dysfunctions. Because at Achieve Integrative Health, we focus on organ dysfunctions. We don't treat diseases, we treat the organ dysfunction. And so by feeling the pulse, the radial pulse, different sections of the radial pulse correspond to different organs in our body. And since there's blood flow flowing in our pulse, we are feeling the blood circulation that's going to all the different organs, and it's letting us know which organs are not functioning at optimal levels. And those are the ones we need to go help and restore their function. Because that's what we do, restorative medicine. So today we're going to talk about the left side. And the left side of the pulse, the first section of the pulse, when we feel your pulse, the first section corresponds to your heart and small intestine. So we can tell us, like for example, just reminded, we have patients that have gluten sensitivity or celiac disease. And so in this section, we will feel their small intestine is inflamed. Maybe we'll feel some mucus, or maybe it's a lot of inflammation, right? And that's how we can tell, hey, is the small intestine getting better? Usually a patient with celiac disease, after they're going through treatments at our clinic, and before we actually feel the improvement in the pulse, they actually start feeling symptomatic improvement already. So the less diarrhea, the bloating, the abdominal cramping, they actually feel less of that, right? But if we don't feel a change in this pulse right here, then we didn't fix the problem. Because remember, fixing the problem is to restore the organ function. The second section is actually corresponds to your liver and your gallbladder. Liver function and the gallbladder function, okay? The third is your sex organs. So it's like for women, obviously it's your uterus, your ovaries. For men, obviously it's the testes, the penis. That's this third section, right? We check that section a lot for women, hormonal imbalance, or maybe infertility, maybe sperm count is low, or we check that pulse. And then there's actually a fourth pulse that corresponds to your lower back, and then your hips, your knees, your ankles, and your toes, and your feet. That's right, low back, hips, knees, feet. That section, that's the fourth section. Fourth section, actually it's like 4, 5, 6 section of the pulse, and we can see, hey, is the joint swelling? Or is there our osteoarthritis or versus rheumatoid arthritis, right? So that's what we feel in the left side of the pulse. So you can see all the organs are pretty much covered, right, in the pulses. There's certain ones that correspond, like the heart also, this part also corresponds to the pineal gland. The pineal gland is what helps, secretes melatonin, helps us sleep. That's also in this first section, okay? Actually, it's really correlates to the heart. In between the first and second section is actually the chest. So we can see, hey, is there any kind of chest congestion right here? We can feel it in the pulse, right? So this is the overview. This is obviously not a pulse diagnosis lesson. This is just to let people know this is how we diagnose patients. This is how we figure out which organs are dysfunctioning so that we know how to use acupuncture, how to use herbs, diet, and nutrition to restore, because we practice restorative medicine, restore those functions, okay? again, we don't treat diseases, we restore function at Achieve Integrative Health. And I'll leave you with this one last bit, because a patient yesterday was asking me, she's just mesmerized by this pulse diagnosis, and we helped her, I think she's 47 years old, and we helped her get pregnant, and now she was wondering, hey, can I tell the sex of the baby through pulse? And some of my mentors, they can. I haven't personally mastered it where I'm 100% accurate, but I'm still testing it out. But yes, there are some people that can detect the sex of the baby just from the pulse. Okay, so she asked me to try it out, and I wrote it on a piece of paper. And when she gets the ultrasound, we're going to confirm if I was right or not. So that was pretty interesting. So functional pulse diagnosis, it can tell us, it's like the human X-ray, human MRI, right? The Chinese medicine, acupuncture MRI, acupuncture X-ray, we can see it on the pulse, right? So hopefully you found this beneficial. If you have any questions about this, comment below. Tags, someone who may be interested in learning this. We do teach acupuncturists all around the world on our functional pulse diagnosis. But yeah, if someone needs help, maybe they have they've gone to the doctors, they've had all the blood tests, all the imaging, and they still can't figure out what's the problem, then sometimes pulse diagnosis can give us a better clue as to what is actually happening and which organs are dysfunctioning, and therefore that's why they still feel like crap. So this is discovered 3,000 years ago. How they discovered, I have no idea, but it still works. It's been around for 3,000 years. It's been time tested. That's the best, time tested. Okay. All right. So let me know if you have any questions. And yeah, I think this is. I mean, we're still learning, and this is just phenomenal. I mean, just the fact that feeling someone's pulse can detect organ dysfunction is mesmerizing. All right, guys. This is Jimmy Yen from Achieve Integrative Health. As always, everything in life is achievable, but it's up to you to make it happen.